Hi there, my name is Katya, and today I will be demonstrating a chest tube dressing change. So this cereal box here is my lovely patient, and we will be changing their dressing. So, a couple things, I've checked the orders, I've already explained the procedure to the patient, and they're okay with that. I checked the wall suction, it's set to continuous suction. I'm checking my tubing for any kinking, making sure it's a closed system all the way, and checking the drainage chamber for amount, color, making sure I document all of that. And then I have my emergency supplies at the bedside, so my forceps and my sterile water. I'm going to put the patient into semi-Fowler's at a 45-degree angle. And I think I'm set to begin. I'm going to wash my hands, and then I can set up my my dressing tray here. So careful to touch only the 1-inch border to maintain sterility. Sorry, my camera angle is not the best. Grab my blue forceps out here, place on the side. I also want to note that in the actual clinical setting, this would be at waist level. My sterile field would be at waist level. But my table is very, very tiny, so this is just the way it has to be. I'm going to grab my sterile drape out of here, and just for spatial purposes, I'm just going to put that on the side. The garbage bag is ready to come out of my tray, apparently. So I'm going to grab that, and again, for spatial purposes, I'm just going to place this on the other side of my patient here. And then I'm going to start adding my supplies into my tray. So my first thing I'm going to add here is my gelinette. So I'm going to open that up and use my forceps to put that in my field. That can go in the garbage. Then I'm going to add my 4x4. This will be part of the dressing. So banana peel, open that package, pull that in, and place that in my field. And then also my drainage sponge. We're going to banana peel that open and add to our field. And then I'm also going to want to add my sterile water into my tray for the cleaning portion. So I'm going to just open up that and pour from a little bit of a height. Careful to make sure that I'm not touching the container, because this part isn't sterile, to my actual sterile field here. So I'm just going to pour that in. Careful not to splash. And then we can just place this container off to the side. Now that I have all my supplies here, I can put on some gloves. I have my clean gloves here, and we're going to remove the old dressing. So, oops, oh my gosh, here. So, oops, sorry, my screensaver just came on. Sorry, I'm actually going to move the mouse over so I don't accidentally stop it. My hands are still clean. There's not a laptop in this scenario. So I'm going to stabilize the tube as I pull off the me-fix here. So don't want to accidentally pull the tube or displace it. I'm just going to pull off the edges here first. There, so I can begin to pull this away. Did a good job of sealing this up. There, so I can pull the dressing off. I'm going to check the dressing for drainage, amount, type, everything like that, because I will want to document that. put that in the garbage. These are now soiled gloves, so I'm just going to take these off, clean my hands, and I'm going to use my forceps here, my blue forceps, and I'm going to remove the old gelinette. So I'm going to pull that away and in the garbage, and I can throw away those forceps as well because they were out of my sterile field. So I'm going to assess the wound site, making sure to document color and anything else that needs documenting, drainage, anything dried on the edge. And now I can start to clean with my normal saline. So I'm going to use the sterile technique. So I'm going to open up my sterile gloves here. Making sure that my packaging doesn't close on me. So grabbing the inside to keep the outside of the glove sterile. Can put this on. Oops. Fell out. Hands are a little sweaty. Okay, so I've donned my sterile gloves, and now I will prepare my rosettes. So I will start making my little rosettes in my tray, and then I'll dip in the sterile water, or my sterile saline, I guess. And then I'll work my way from the innermost to the outermost. So this the cleanest part. So I'm going to do a swipe, one continuous circular motion, and toss that at a height just to ensure the sterility of my forceps here. Okay, and a little more of the outer. Oh my gosh. Okay, still sterile hands here. I'm gonna do a little bit more of an outer wipe and dropping from a height. And then I'm gonna do my outermost circle. And just a continuous circle there, making sure that I don't touch my forceps to anything that hasn't been cleaned yet. Okay. And then I'm going to clean the tube, so I'm going to wipe the top of the tube and toss that away. And then I'm going to get rid of that extra normal saline, and I'm going to just so delicately do the bottom of the tube. And now I can dry my area, so I'm just going to get rid of those extra 2x2s, and I'm going to go for the 4x4. Make a rosette here, and just dry in the same circular pattern, starting at the innermost section. And toss, whoops, missed my garbage there, that's okay. And another one for the outermost area. These are quite a bit larger, so you don't need to do as many. So here's the outermost. Toss that. So now that my area has been cleaned and dried, the tube dried just via air, the whole wound area is dry now. So I'm gonna start putting on my new dressing. So I can put these down, and I'm going to start off with my gelinette here. So I'm gonna remove the package coating, and I'm just gonna kind of form or twist what will be the seal around my chest tube. So I'm just gonna kind of tuck this under and wrap. This area closest to the tube here is all sterile because it's just been cleaned. Let's see. I think the Vaseline's kind of worn off my gel in it. Okay. It's fine. We've created a good seal. If I had contaminated my gloves, then I would switch to the clean technique, but I've only touched the gel net and the innermost part that I just cleaned, so that is okay. Now I'm going to put down my drainage sponges. These sponges have seen better days. They've done a couple attempts here. So I'm going to lay this down. And just pull that. It's around my tube there, and I'll put the other one at a different angle. You can put that just up and down here. And just kind of place it so that the entire circumference of the tube opening has the drainage gauze around it. Now I'm going to place my 4x4. Oh my gosh. Sorry, my screensaver. I'm going to place my 4x4 on top here. Okay, and now that's everything I need out of my sterile field. So I'm going to say that these gloves are just considered clean now, and I'm going to apply my MeFix. So I have my MeFix here. I have my signature, the time and the date on my MeFix. You can't really, it might be backwards just because I'm filming off my MacBook. And I'm going to pull it apart, loosen it up, and I'm going to pull the inside paper off. And then I'm just going to place this on the side here. And we want to ensure that we got a seal on all sides of our dressing. So I'm going to need another piece. We're just going to, sure, I'm going to grab another piece here. Pull that off. I guess I should put that in my garbage. Oh well, that's fine. And I'm just going to lie it down here. Pull that off. Oops. I've kind of covered the date that I wrote here, but I think MeFix is kind of see-through enough that you can still tell. And this will also all be documented, so it should not be a secret. But it was changed. I have my tiny piece here, and I'm just going to place this underneath just to ensure that I have a full seal. Around my chest tube. Okay. There. Looks good. I'm going to clean up all my supplies, take off my gloves, wash my hands, return the patient to into how they were before, but at the lowest level, how they want to. My exit safety checks. And that is how you do it.